their personal lives and the lives that they're going to impact, correct? So part of the discussion that I'm going to have with you today is how do we take ownership of our own health? So I just started working for Gilead about 18 months ago, and honestly, before I started working for Gilead, I was an activist and advocate that was speaking up for communities and also like banging the table across from Gilead. And one of the things that they actually allowed me to do was to give a talk about HIV as a social justice movement. How HIV is the intersection of racism, sexism, homophobia, poverty, geography. So if you take all the isms and then you put poverty, healthcare access, that is the intersection of HIV. And I still believe that today. But as now a employee of the company, when they did this tagline, I don't think that they thought about how powerful that is. When they say, honestly, it's time our health is worth protecting. And that, to me, just rocks me to my absolute core. Because if I ask you, and I will ask you, name all the ways in America in which we tell either queer people, black or brown people, that they are going to die faster than everybody else in the United States. Just name a couple. Police brutality, right?
Unprotected sex.
Huh? Discrimination, heart disease, liver disease, diabetes, cancer, giving birth, being born. Like everything that we do is kind of scripted, that there is this kind of destiny that we won't get a long, healthy life in the United States. And I want us to declare that our health is worth it. That like living a long, healthy life is a right that we can claim. And that just because we've come from a legacy of not having the best health outcomes in the United States, that we can declare that we will have a long, healthy life. And so this idea that our health is worth protecting, that we will protect and not react to things. So for the most part, it's not just us. It's not just the people in this room. For the most part, in the United States, most people are not involved in healthcare. That means going to the doctor to stay healthy. That means having regular checkups. We're involved in sick care. So you go to a provider, you go to a healthcare provider, a minute clinic, an emergency room, in acute care when something's broken or you're dying. Otherwise, if it's not broken or you're dying, you're going to wrap it up with ginger ale, Robitussin and duct tape. And that's just where we are, right? Like that's just where we are. So, but if we are not actively protecting ourselves, we are passively accepting that something can happen in our lives. So if we, just for example in this discussion, if we are not actively protecting or preventing ourselves from HIV, we're passively accepting. So I'm going to just use one example of how valuable healthcare is versus sick care in the United States. If we have a 20-year-old male newly diagnosed with HIV in the United States, and he does not get an AIDS diagnosis, he immediately goes on treatment soon after he became HIV positive, that 20-year-old male's life expectancy is plus 55 years. That means that a 20-year-old with HIV on treatment's life expectancy is 75 years old. A 20-year-old HIV negative male in the United States, their life expectancy is 52 years. That means the life expectancy of an HIV negative young person is 72 years. The fact of the matter is that because of healthcare, because of being engaged in a system that supports us biomedically, supports us psychosocially, housing, transportation support, tries to create spaces like this, the life expectancy of a young person with HIV is outpacing the life expectancy of other Americans. Anybody in this room know that? And that is so, and it's only getting better. That number came out in 2015, and each year that we improve the system, each year that we do better in this room, we do better as a safety net for people who have been otherwise potentially vulnerable in this world. But we have to do better for all of us, and not just for those of us who are HIV positive. Yes, sir.
So you're saying the reason that is better is because the one that is HIV positive, they go to the doctor basically all the time because of the medicine.
To stay healthy.
And then the other ones is not, that's not.
More
so
so
that's
than
why
that.
they got a longer life.
Because the support system that we have created in HIV makes sure that your HIV is taken care of, that if your housing is unstable, that that's taken care of, that if you need transportation to those services or other health needs, that that's taken care of, that you actually show up to high five and tell you that you're already doing well. And while you're here, since you're doing well with your HIV, let's think about how you're emotionally doing. Do you have depression? Do you have heart disease? Do you have liver disease? And we're more likely to find them when they're pre-diabetic, pre-hypertensive, than just when they have a heart attack. Wow. And that is the value of healthcare. But that's also the value of support and holistic health. Looking at the person from top to tip and treating the person as if they're honestly worthy of our efforts.
Shit, I get all of those services
So,
because I got cookie
just
cheese.
understanding like what we can do and how we have created this system in HIV care, I think we have to kind of create this entire system for all people. And I think it starts in our community. So I'm going to play this commercial. If you haven't seen it, this is the Healthy Sexual commercial.
Honestly, we should have used a condom.
If you watch the post, you saw it.
Yeah,
But honestly,
It's the same.
I'm afraid to find out.
Honestly, we've been together for a while, so getting tested never really crossed my mind.
Honestly, no one wants to think about HIV, but there are things that everyone can do to help protect their sexual health.
Condoms are a great start.
Get tested and ask a healthcare provider about all of your prevention options.
Because honestly,
Our health is way more technical.
So yeah, you saw Pose, you saw that commercial, almost every commercial break.
right.
But the reason why we did it is because we were hearing time and time again that outside of certain pockets of the United States, most people thought that HIV was over, right? And that did not just happen on Pose. If you watch Jimmy Kimmel, any late night television, anything after 9 p.m., pretty much you might have seen this commercial. So I'm going to talk a bit about healthy sexual in general. Has anybody seen this presentation before? No. Yes, you did. You did. Yes. So healthy sexual is this idea, is a concept that health and sex deserve to be in the same room. And this is beyond you look healthy, you look sexy, let's do it. Like this is beyond that conversation. So this is, I'm going to talk real, honest, factual information. I'm going to have booklets here, so anything that you see in the presentation, I'll also support it with a booklet. But what we want is that we're having affirming conversations about sex and just understanding that sex can be more enjoyable when fear is taken out of the equation. And the way that we take fear out of the equation of sex is that we feel empowered and educated that anything I want to prevent, I can prevent. And so that's this presentation. So we're going to talk about STIs, we're going to talk about HIV, we're going to talk about risk factors, prevention options, testing, healthcare provider. I'll tell you, Gilead thinks that they are beyond edgy at this point because they have emoji with eggplants. So we also have pussycats and we have donut holes. I'm not believing that anybody is going to be offended today. But we're going to talk about the nuts and bolts of STIs.
Oh, I'm offended
So,
by that eggplant emoji.
your leaders, you have people that are going to come to you and they're going to say, I think I got something, and you're going to have to be able to say, that's not how you get it. That's an important way. Just as much as you're like, you might have something, you need to be able to tell somebody, how do you get something and how do you not get it? So on this slide, you're going to look at skin-to-skin contact and bodily fluids. So skin-to-skin contact is what, I'm going to separate these two into the get-on-yous and the get-in-yous. So the get-on-yous mean it doesn't require an exchange of fluids. It doesn't require penetration. This is a good dry hump and you can pass something, right? Or a hand job. Like this is, what's going on in this?
A hand job.
So, yes, a hand job, skin-to-skin contact, and you would be able. So this could be oral sex, vaginal sex, or anal sex. So syphilis. So leaders, tell me, what is the first sign or symptom of syphilis?
Canker sore.
Yes,
The
shape
rashes.
sore. So it's a painless blister. Where does that show up?
Anywhere.
Anywhere. So you can have a painless blister anywhere. So if you had oral sex and got syphilis, that painless blister is going to be in your throat. So you suck something in your mouth and then you put something back in your mouth and then you pass it.
Oh, walk
right?
right out, suck
So it can be in your rectum, it can be in your vagina, wherever you came in contact, here you go. Syphilis, what is the second sign or symptom of syphilis?
The rash.
A rash. And you're telling me what is unique about the syphilis rash?
First, unsuccessful will be on that palm of your hands and sole your feet.
There are a million reasons why people may have a rash in this world. It could be bad detergent. It could be a reaction to a bug bite. But if you encounter somebody with a rash on the palms of their hands or the soles of their feet, that is syphilis. Yes. So sometimes, honestly, like I'm in meetings and people are scratching their hands, I'm like, either they're about to get some money or they got syphilis. Like,
My hand only itch when I get some money.
Sit here and do this all day? Yeah, it usually does spot, but not always on people of color. So what I don't ever do is depend on the pictures on the internet to tell me whether or not it's an STI. Just like we don't take pictures of every sunset, you take pictures of the most remarkable sunset. Right. People don't take pictures of every incident of an STI. They only take pictures of the very worst. And it's very hard to find pictures of sexually transmitted infections on people of color. So all the pictures are big red or brown bumps on white skin. And so it's really hard to distinguish what does a rash look like. So when I would do health information presentations, I used to try to find presentations that had people of color. And when I couldn't find them, I just decided pictures weren't worth 1,000 words. That being able to tell people is not going to be the worst picture you've ever seen. It may be one bump or it may be 12 or 1,200. But just know that testing is the way that you know. You're not going to be able to diagnose everything on site. So that's syphilis. You can either pass it when somebody's itching on their hands and the bottoms of their feet, or that chancre, that painless blister. So herpes, I think we're pretty, good about what genital herpes might look like, and you can pass it during an outbreak. HPV, we're talking about genital warts here in terms of skin-to-skin contact. What are the bodily fluids of HIV? Are going to be pre-cum, cum, blood, vaginal fluids, and breast milk, right? So chlamydia, gonorrhea, also, these are getting you. They're going to be transmitted through fluid-to-fluid contact. So let me tell you about gonorrhea. How do we test for gonorrhea and chlamydia? Huh?
The Q-tip.
Yes, if you're doing it right. Who said the Q-tip? If you're doing it right. So how do we generally do it though?
Blood test.
No.
Urine.
Your analysis.
So most people,
I'm glad I never have to go through none of that shit.
Chlamydia, we do a blood test for syphilis,
Nasty
and we have
hole.
somebody pee in a cup for gonorrhea or chlamydia. So what is the problem with peeing in a cup to diagnose gonorrhea or chlamydia?
It doesn't detect all sites.
It doesn't detect all sites. If you have oral or anal sex, peeing in that cup will not detect. Yes. And this is the thing. Surprise, surprise. Some people may use a condom for anal or vaginal sex, but not use it for oral sex. Anybody here know anybody that uses a condom 100% for oral sex? 5% for oral sex.
He does.
1%.
What?
So exactly. So a lot of people will protect themselves one way and not another. So hepatitis A. How is hepatitis A spread? Fecal matter. How does this become a sexually transmitted infection? There you go. I call it the tossing salad or tossing salad virus. Right?
I ate for the
So
first time.
Hepatitis A
Recently.
is the reason that every bathroom in a restaurant says if you're an employee, you must wash your hands before you go back to work. Because if you have an employee or any food preparer and they are preparing your food and they wipe their behind and they did not wash their hands and they have hepatitis A, when they touch your food, you will now have hepatitis A, right? Or you're eating ass, tossing salad, oral anal sex, whatever it is, eating like groceries, whatever it is, transmit hepatitis
Y'all
A.
need to stop eating that
Right?
ass.
So there you go. Hepatitis A, oral anal, anytime fecal matter gets into your mouth or your seafood. So anybody here that likes raw oysters or my Louisiana people, crawfish or Texas
What can I get from eating pussy?
And right after a hurricane, you have sewage in your water. You're gonna be careful because they're gonna test for hepatitis A. Yes, Jason.
Could you contract hepatitis A from unprotected sex and it gets into your urethra?
Yes. No, it's fecal oral. So yes, you could if the penis had been in a butt.
Okay.
So yes. So yeah, if somebody puts it in the butt and puts it in your mouth, yes. Yes.
Oh.
Absolutely. Are we live? Absolutely. You can. And you should know.
I'm not eating at McDonald's.
Right? So that's how hepatitis A is transmitted. The great thing is there's a vaccine against hepatitis A. All this is about is let's prevent our preventables. Life is going to be hard. There are lots of things that we will not be able to control in our world. We should control the things that we can control. All of this is about controlling our controllables. Take the power where you have it. So if you can prevent hepatitis A or hepatitis B, absolutely, go on and do it. Hepatitis B, how is hepatitis B transmitted? That too. Hepatitis B is transmitted every single way that HIV is transmitted, except it's easier to get. So I'll tell you, out of all of these sexually transmitted infections, HIV is the hardest to get of these. HIV is not an efficient sexually transmitted infection. All the others, if you come in mild contact with them, you're likely going to get them. HIV, we have the advantage that HIV doesn't live outside the body. HIV needs an entryway into the body. The immune system, most exposures to HIV do not become infections, but I will talk about the factors that will increase the chance that an exposure to HIV will become an infection to HIV. Hep C, how is Hep C transmitted?
Heavily intervening.
It's not the needles though. Needles aren't just walking around like, be positive. Blood. Okay, here we go. So let's not blame needles. They got enough going on. So it's actual blood to blood contact. So it can be sexually transmitted. It can be through drug use. It can be through razors. It can be through toothbrushes. So Hep C, Hep A, Hep B actually live outside the body. HIV does not, but those viruses do. And then why do we even care about trichomonas? Nobody cares. Nobody wants. So trichomonas. So let me tell you, there are a lot of things that HIV has taught us. So what we looked at is that there were prostitutes or sex workers in South Africa. And you would have certain sex workers who are having sex with the same Johns, condoms without condoms, and some would get HIV and some would not. And you're like, but they're having the same sex. Why is everybody not at the same risk? And so what we learned is that the body's biome, our natural environments of our genital areas, can affect whether or not we get HIV. So what we were able to find is trichomonas, either having it vaginally or rectally, significantly increased the chance that a person, all other things being equal, would get HIV, because that low level of untreated bacteria caused enough irritation that it could potentially cause tears in the skin, microscopic tears, so that during sex, which is friction, which feels great, that during sex that it could cause those microscopic tears to become larger and become an entry for HIV. So it's a bacteria that our bodies can generally cure, can be treated, but we actually care now because we know that it puts people at higher risk. Yes?
So, Danielle, and maybe you don't have the answer to this, but I know syphilis increases your chances of contracting HIV like tenfold. What is the percentage around trichomonas?
We don't have a percentage. So between gonorrhea and chlamydia, it's around 5 to 8%, and having syphilis increases your chance, depending on whether it's vaginal or anal, somewhere around 20% higher in any given year. So let me do a quick demonstration as to why HIV, having an untreated STI, and do y'all know why I say STI instead of STD? Right, so an infection is different than a disease. So disease means that you have left this long enough that it can actually cause harm to your body. So we want to treat things, you actually pass an infection, we want to treat things before they cause disease. So I specifically say sexually transmitted infections as opposed to sexually transmitted diseases. It's annoying, but the CDC told me that I need to change that. So I also will say condomless sex in regards to HIV and not unprotected. Because once you have multiple ways of protecting something, you can't say that something is unprotected, right? So let me tell you about HIV. I'm gonna put the mic down, but y'all can hear me, right? So great. So here. What cell does HIV want to infect? The white cell. T cells. The simple thing is that the T and T cell movie about the bubble boy? Okay. So there's a movie about a bubble boy. The boy lived in a bubble. He didn't have a thymus, so he had no immune system. So your thymus is responsible for making CD4 cells. CD4 cells are not your only immune system, part of your immune system. They are the generals of your immune system. So they kind of do the monitoring. They tell everybody what to do. They're management. They go out, they tell people what to do, but they don't actually do the work, right? So, in general, your CD4 cells are living up here. So when you have like a sore throat or your lymph nodes, that's your CD4s, like kind of revving up more CD4 cells. So they're here. Most exposures to HIV are in the playground, in the general area, right? So they're all down here. So, if you have an exposure to HIV, it has to go all the way from the genital area up to here to find the CD4 cell. All infections start with one virus meets one CD4 cell. And it gets into that CD4 cell, and in one day, it can create 1 million new viruses. Now, most of those viruses will be duds. About 100,000 of them will be good, and those 100,000 will go out to infect new CD4 cells. That's how all infections start. One virus, one CD4 cell. Now, it's a pretty big freeway in between here and here. You have other immune systems. They know that something's in there. They're generally going to attack it. And so most exposures to HIV do not become infections to HIV. But this is why having an untreated STI will increase the chance. If you have gonorrhea, chlamydia, syphilis, herpes, HPV, trichomonas, any of those things, your CD4 cells have to go down to your genital area to monitor the situation and make sure that it doesn't get out of control. To control what it can't control because it can't cure itself. It just keeps it monitoring. It brings in whoever's going to help, control the situation. Those CD4 cells are going to stay in the genital area until that infection clears up. So if it's a week, if it's a month, if it's 2 years, for that time, you're at a much higher risk of getting HIV during that time. So, what happens though is as soon as you get that infection cleared up, the CD4 cells are free to go back to where they're supposed to be. So, if you have a person who is, say, HIV, so HIV, untreated sexually transmitted infections, if you're HIV positive and you're not on treatment, it will actually, because the CD4 cells are there meeting HIV in the general area, it's revved up. If you're not on treatment, so you have a detectable viral load and you have an STI, it makes you more infectious. You have more virus in your genital area. And if you're HIV negative and you have an untreated STI, it's going to increase the likelihood that you get HIV. So if you have somebody who's not willing to necessarily use condoms, if you have a person standing in front of you who also doesn't want to do PrEP, what you can in terms of reduction is negotiate with the person and go, listen, you know what? Like, all I'm trying to do is uplift your health. Are you at least willing every 3 to 6 months to go and get tested and treated for anything that you have? And you can significantly decrease the chance that they get HIV, somewhere around 10 to 20% on any given year. So what we're trying to do is just find options for everybody's life. Every single person that I know, that I encounter in this room, can make any decision about their lives that they want. I am not in behavior change. I'm in letting you know your options. So I'm okay if somebody is living with HIV and they say, I don't want to go on treatment. I'm not okay if they don't go on treatment because they don't know that there are options. But if you're informed of all the options and you make that choice, I'm with you. And as long as you keep showing up to have a conversation, it's always an opportunity. So what we're trying to do here is just make sure that we're uplifting people's health and building people's prevention the way that they want to have it. And so that's why we're here. Do we have any questions around the get on use, get in use? Okay. So the first thing we're going to build into our prevention toolbox is testing and treating our way out of all the curable STIs, right? So this is the taking control of what we can control. So my next question is, how well do condoms work to prevent HIV? I hear 99.9%. Somebody give me another number.
97?
97%? 92%? 72? 98? 90? Okay. How would you study this? How would you find out how well condoms work for the prevention of HIV?
If they use it,
Right? You can only test it if you were having a serious courted couple. coupling. They don't have to be like married. Coupling. So one person's HIV positive, one person's HIV negative, and the person who's HIV positive couldn't be on treatment. Because I'm going to say this over and over again. HIV positive people on treatment undetectable do not transmit HIV as long as they remain undetectable. That is my favorite piece of news. But yes, so treatment is prevention. And so if a person is HIV positive and undetectable, they do not transmit. So we actually did those studies years ago before people could really get treatment easily. And we looked at serodiscordant couples. And we looked at how people in serodiscordant couples, one positive, one negative, were actually having sex and using condoms. And we said, okay, how well in this coupling does it actually prevent HIV? And we didn't do any intervention. They said we use condoms consistently to figure it out. So we're talking about condoms alone. So this is not condoms plus lube, because in HIV prevention or for the any use of condoms, wetter is better. So this is not condoms plus lube, this was just condoms. So I'm also going to tell you, so we're going to get to what the efficacy is, but I'm going to tell you that we lie every single day in public health. We lie in public health because we tell people that HIV risk is based on the number of sexual partners that you have and whether or not you use condoms with those partners. Why is that a lie?
Because if someone is not living with the virus, how can they transmit it?
Right? So if you weren't having sex with anybody that's HIV positive, then it doesn't
Or
happen.
if you're having sex with someone who's living with the virus, who's virally suppressed.
Right. So what else is your number of partners and whether or not you use condoms a lot?
Yeah.
You could have sex with one person and get it. Yes? Right, so it has to do with concentration, but it also has almost more to do with geography. It has more to do with geography and zip code than it does with your number of partners. So, here's the example I generally give. The lifetime risk of HIV in North Dakota is close to 1 in 700. If I'm in North Dakota and I said, what's tonight, Thursday? Tonight's Thursday, it's about 8 o'clock, I'm gonna have an orgy, right? How many people were invited? 50? Okay, 50 people. There's a bowl of condoms somewhere in the house, right? So we're gonna have 50 people. You could use condoms, you don't have to use condoms, you can put it wherever you want and you can have sex with whomever you want, right? If I have 50 people in my house, and the chances that 1 in 700 people in the entire state are HIV positive, it's not likely that anybody that I called up is going to be HIV positive. So no matter what I do and where I do it, and whether or not I use condoms, no HIV will be transmitted in a community in which HIV does not exist. Now conversely, anybody tell me what the lifetime risk of HIV in DC is?
Oh, wow.
Yes. It's the highest.
1 in 3.
Not 1 in 3.
1 and 2.
1 in 13. So 1 in 13 people in DC is likely to be HIV positive or contract HIV. 1 in 13. And next after that is Maryland, which is 1 in 49. Rounding that out is going to be DC, Maryland, Louisiana, Georgia, New York, California. Y'all know.
Florida.
So DC is number 1, right?
Florida's
So 1 in 13.
Yeah.
And in some of our communities in DC, we have wards here, wards 6, 7, and 8, and I would specifically say zip codes 20020, 2002021. The lifetime risk of acquiring HIV in those neighborhoods is 1 in 4 and 1 in 5.
Oh.
Right?
Move out of those zip codes, girl.
That's even if you're a man who has sex with a man who knows. Right?
Yeah.
So I don't know who y'all partying tonight, but
Is that the zip code to the ball?
So if you have a 1 in 13 chance or 1 in 4 or 1 in 5 chance,
Is that the zip code to the ball?
orgy in that same community.
Is that the zip code to the ball? Oh, okay.
Yeah, no. So I threw an orgy in that same community or in DC general, even if it was just in this hotel. There are about 50 people in this room. Whatever. So the likelihood, if I invited my DC friends to that party, that anybody, 5, 6, 7, potentially 10 people at that party may be HIV positive. We're doing the exact same steps. We have the exact same prevention options. The only thing that changed was geography. And so we do an all lives matter prevention people of color tend to have fewer partners, use condoms more, and get tested more often. And yet, we have a different forecast. The other part of that is going to be access to healthcare. What is our access? So what is the likelihood that anybody living with HIV in our communities is not undetectable or virally suppressed? And we can't just put this on people. We have to think, if you have hourly jobs, you can't take off to go to a doctor's appointment, or you don't get paid. Like, all of these things play into it. Or do you live in the 9 states in the Deep South where Medicaid was not expanded and had 52% of the new infections, right? We also have young people with less access, and greater than 50% of all new infections are happening under the age of 25. And then you change these dynamics in terms of sexual networks and communities. If you start talking about, you know, gay, trans, like, all of these things change. And so when we use, like, all of these, like, if we give cookie cutter messaging to people, we're going to do a disservice. So what data allows us to do is to triage, is to give the most resources and time to people that need it the most. But that's what you do on a day-to-day basis. Houses were built to support the most vulnerable, to create spaces of safety and acceptance for people where there wasn't a general acceptance in the community. So you're built for this, to be able to triage and offer more support for those who need it most. So understanding sexual networks, having conversations are always a good idea. So about the having conversations are very important. I can tell you that conversations are not happening in general. Even for myself, and I just use me as an example because I just tell all my business, I do not know the HIV status or STI status of all of my partners. I've not asked it, I have not thought about it necessarily, but what I have decided is that, like, I don't know what they're doing, but me, like, for me, the only thing I want to take from my next sexual experience are the memories. Like, I don't know if I'm going to marry this dude, but I also don't want his daughter to be a syphilis or HIV, right? So, like, whatever it is, it's just like, it's my health. I'm like, okay, what am I going to do? But I know that I'm not having conversations, but those conversations are useful. And also, like I said, the who and where you have sex matters. So we are going to talk about condoms and lubes. We're going to talk about what makes it STIs. We talked about how it makes it easier, and then knowing your status. So condoms and lubes. So I'm going to give you the actual numbers as to how well condoms work to prevent HIV. Condoms. So using a latex or polyurethane condom consistently. Currently, when used consistently, condoms can reduce the chance of getting HIV for anal sex by 70% and 80% for vaginal sex. And I told you, the only difference is the wetter is better.
My number's bigger.
Huh? So, yes, in terms of the risk, it's just because anal sex the anus tends to have less natural lubrication than the vagina. That may be a preference. But these are not bad numbers. Anybody ever heard of, like, an HIV vaccine that we're all waiting for? Yes. And so everybody knows that we're kind of, like, waiting for this magical vaccine. If we had a vaccine that worked 80%, it would be adopted and used widely in the United States. So I'm telling you that condoms work as well as the vaccine that we're all waiting for. They cost about 10 cents. We already have them. And they're the only multi-use prevention option. They work against most sexually transmitted infections, pregnancy, including, and then also HIV. So they're multi-use. I'm, on the other hand, I'm one of these people who believes, regardless of what I say in any of these rooms, people have already made the decision about whether or not they're going to use condoms. And by the age of 25, I believe that most people have developed their sexual preferences around condom use. So, if somebody uses condoms, they are a person that uses condoms. If you have a person who has chosen that condoms are not what they're going to use, or they're not going to use them consistently, we have to find ways to make that choice safer. Whether or not they're already HIV positive or at risk of acquiring HIV or other STIs, either way, regardless, status neutral, we need to make that decision safer. So we could spend a lot of time talking to people, trying to convince them that they need to use condoms. We can give them information, and then you allow them to make that decision. But you'll hear people say, well, if they don't use condoms, then they shouldn't do this. Or I'll also tell you this is what I don't believe in. I don't believe in should. Should is my opinion and should is my rule book. I cannot should anybody else's life. I can could their life. They should use condoms. They could, that's an option. But should is from my rule book, right? So anytime, and I tell this to providers, especially doctors, anytime they hear in their mind, people say should, well, they should just do this. And I'm just like, Like, understand that that's always going to expose where your bias is. But nobody else is necessarily reading or following your rule book. So here we go, how to suit up correctly. Checking the expiration date, pinching the tip, rolling it down, using lube, having some fun, and tossing it in the trash can. Toilets do not want your condoms. They don't want your tampons, they don't want your condoms. Please stop flushing the condoms down. But, so this is how we use them correctly. I heard a boo. So sex causes friction. Frictions cause condoms to break. Lube reduces friction and helps you avoid breaking. So let's name the lubes that are not condom safe. Vaseline.
Vaseline.
Oil, yeah, Vaseline is a no. Baby oil is a no. Lotion is a no. Crisco. Yes, the first, the original lubricant. Spits and saliva are not good lube. Not all, yes. So, you know, we know it's cheap, we know it's free.
Wow, that's disgusting.
Who said that's disgusting like you've never heard of spit as lube? Oh.
I heard of it, baby, but that's disgusting. You hear? What?
When you made that first noise, I'm moving. I'm not going to stay I'm not staying for part 2 of that message. So, water-based lubes, silicone-based lubes. I know that the Department of Health here in DC actually gives like waterproof silicone lubes so you can have sex in pools and showers. So, you know, we know that there are options, but no oil-based lubes, no Crisco, no Vaseline, no hair gel. Like, just don't, you can't just grab it from Google hair gel. You know, for your baby hair. So let me tell you though, in the harm reduction world, so these are non-condom safe lubricants. If you're having condomless sex and the option is between Vaseline and no lube, then there's a different option, right? So having some lubrication will be better than no lubrication. We're talking about condom safe lube, but still they're not good. Because not only is it just like whether or not they break a condom, there are certain things, I told you that friction, that irritation increase the likelihood of getting HIV or other STIs. There are certain things that are not just made for your skin, that skin, and so if it causes irritation to the skin, it can also increase the chance. So we have, so far, we're getting tested on a regular basis. We understand whether or not condoms alone are going to be our prevention option. We know how to use condoms correctly. We understand how our geography matters in terms of our HIV risk and therefore prevention. So it's not like, yeah, geography and sexual networks matter. And we also understand that lube is our friend, right? So this is us building our. So what we have talked about here is we are talking about behaviors. Some of the behaviors we talk about are getting HIV tested, talking to your partners, learning more. These are behaviors. Barriers are condoms or female condoms. So those are barriers that puts a place between you and the sexual fluid. We're going to talk about biomedical. These are the medicines that actually prevent or treat disease, right? So we talked a bit about this. We're going to talk about vaccinations, PrEP and PAP, and treatment as prevention. So what are the sexually transmitted infections that we can prevent with vaccines? HPV, hepatitis A, hepatitis B, right? So HPV vaccine, when it was first approved, it was only approved for girls 13 and over. HPV is sexually transmitted. Everybody's like, oh, I don't want my daughter to get cervical cancer. And then they were like, well, what about your boy? And they're like, well, I mean, he can only have HPV, he can't get it. And then we were like, he can get anal cancer. And they were like, well, my son's not going to ever have anal sex. That's a lie. So, yeah, exactly. So now it's approved. Now, so then you can also get oral cancer. So if, be like, your boy could get oral cancer. Because if he goes down on a girl or a guy with HPV adolescents down to 11 or 12, hepatitis A and hepatitis B. If you're under the age of 25, you likely have already gotten Hep A or Hep B vaccine. So it's now the standard of care. If you're over the age of 25, I'm not going to call anybody out, but I'm over the age of 25. I did not receive it in my original batch of adolescent vaccine. So it is something that we can vaccinate against, and we should. So if you get tested now, if you walk into your healthcare provider, prevent our preventables, you go in, you can eat as much ass without, like, hepatitis A, if you just got vaccinated. Because then you can never get it. You can never get it. Right?
Call your doctors.
There you go. It's all about preventing our preventables. Because you don't want to be like down there and be like, but I don't want to do Hep A. So let me tell you, even if you get hepatitis A, you can never get it again. You'll get it, you'll have a bad case of it, and then you can never get it again. Yes, sir.
And if you don't know if you've got those vaccines, you can get a blood test and they can see which vaccination that you've had.
Absolutely. They'll do a titer test. They're going to measure your levels of this, and it'll tell them whether you have antibodies for it. You can either have antibodies because you were vaccinated, or you can have antibodies because you've had the disease, your body has cleared it, and now it's protecting it. So you can get tested. Hep A and Hep B have a vaccine. Hep C does not have a vaccine, but it does have a cure. So Hep C treatment used to be terrible. It used to generally be hospitalized, it made you depressed. A lot of people committed suicide, and only about 25% of people would get cured. Now, almost 100% of people with hepatitis C, no matter what type, can get cured from it.
So are you saying once you have Hep C for the first time and your body gets rid of it, you can never get it again?
Not Hep C, Hep A and Hep B. So Hep A, you get it, your body will cure itself, you'll never get it again. Or you can just get vaccinated and then you don't have to worry about feeling bad. Hep B, most people clear it, some people do not. So hepatitis B is another one you do. And it's transmitted every way that HIV is, except it's easier to get. It's called a syndemic, which means that it's an epidemic that happens with another epidemic. In the same communities where HIV is common, hepatitis B is common, except it's more common because it's easier to get. So hepatitis B, if your body does clear it, then you can never get it again. But if your body doesn't clear it, you now have a liver damaging virus that we cannot cure, but we can treat. But hepatitis C, we don't have a vaccine for, but if you have Hep C, which is spread through blood-to-blood contact, we can treat it and we can cure it for most people. So, preventable through vaccines, self-cure, treatment, but no cure if your body doesn't. Yes?
Just real quick, I wanted to talk about the vaccinations for hepatitis A and B. If you are a DC resident or DMV resident, the DC Health and Wellness Center does offer free vaccinations for hepatitis A and hepatitis B. It doesn't, no age requirement, no insurance needed. All you just gotta do is go down to the DC Health and Wellness Center and say that you like the hepatitis A and B vaccination, and it'll take you care of it. It is a series of shots, so if you are going to take it, just make sure that you're committed to doing it and not wasting a resource that someone else who does need it or wants it.
Oh, that's right.
Okay, there we go. We gotta know what it is. So we're going to talk about practice. We're also going to talk about prevention. We have kind of gone through this entire slide. It's not recommended for every child. Hepatitis HPV. If you don't have the HPV vaccine by the age of 26, most doctors will not vaccinate you. It's so common, it's like an iPhone. Like everybody has one. So if you haven't been vaccinated by 26, even if you say that you're still a virgin, you likely will not get the vaccine. But you can actually, so I think we all know that some kids do have sex before the age of 11 or 12. Yes. So if you ask a provider and you get permission from a parent, you can actually vaccinate a young person as young as 8 years old. Yes. So those are those. So we're almost done. So tell me, what does PrEP stand for? Oh my God, I love it. Everybody hears pre-exposure prophylaxis. So that means PrEP is the proof of concept that we can take a pill to prevent HIV, right? So, it means that before, we have to understand, so let me tell you, PrEP is not a pill. PrEP is absolutely not about a pill. PrEP is about an engagement in healthcare. PrEP is a lifestyle change in which people understand their risks They feel empowered to do something about it. They have access to health care, and they're willing to do something every day. That is very hard. That is exceptionally hard, especially to prevent a disease. If you've ever set a goal for treatment or prevention, doing something daily is hard. If you've set a goal, got there, achieved the goal, and then backslid because you didn't do everything on a daily basis that it took to get there, then you understand that this is not just about taking a pill. So this needs community support. It means to not shame anybody. It means that you should be able to have sex your way. Like my job hates me because I'm always like, people should be able to fuck with freedom. Like I just want people to be able to have sex the way that they like to have sex, right? And so, but sometimes in meetings I say frolic. I like the word frolic. Yes, and when people are resource limited or poor, I also say that, we have made sex not fun, and I'm like, fuck is the most fun you can have for free. Like, you got two broke people, like, what you doing today? What you doing today? Like, this is just one of those things. And so, PrEP is a healthcare engagement. PrEP is about healthcare engagement. PrEP is about being engaged on a daily basis, and then on a regular basis after that, to remain HIV negative. And if you don't think that you're at risk, if you get tested and you had condom sex with 15 people over the past 3 months, and you test HIV negative, and in your mind you start to think, well, I guess I didn't have sex with enough people to get HIV, then it must be, the people who get HIV must be the people who have sex with 20 people, then you start to really internalize that you're not at risk. And what we've traditionally done in treatment and testing is test and release. We test people and we put them out in the world, and we don't give them an option. But if they get HIV, we throw a whole bunch of services at people. So we have to understand that testing, HIV testing, is a point of entry for healthcare engagement regardless of what your HIV status is. Again, honestly, it's time that our health is worth it. So if you're HIV negative, you're engaged in a set of care, healthcare, regardless of whether or not it's PrEP or not, you're engaged in healthcare about staying healthy that includes your sexual health and HIV prevention. If you're HIV positive after a test, then you're engaged in a set of healthcare that includes HIV treatment and sexual health. But regardless, there should be an option to stay healthy on any side of the spectrum. So PEP, tell me about PEP. Post-exposure, how long do you have?
72 hours.
And I can tell you that PEP, so with PrEP, we use 2 medications. We have 2 medications, 1 approved medication. So we use 2 medications to prevent HIV, 3 medications to treat HIV. PEP, they're generally going to use 3 medications. But when people have had high-risk exposure, you show up to a healthcare provider within 72 hours, and you take those pills for 28 days, we see 0 infections. So it does work. And some people can't commit to taking a pill every day beforehand, but after they've had a scare, they're willing to, take it for a month and then, do something else. But, so PEP and PrEP. But you should know where. So say one of your kids is sexually assaulted, or is with a partner who discloses later that they're HIV positive and on treatment, or the condom broke. You should be able to tell them where to get PEP. Because what you don't want is that regret to be the outcome of that. We do have options even after the fact. Yes?
I just want to point out that PrEP and PEP both they have higher efficacy, or not efficacy, but higher levels of protection than condoms. And just to point out that you can use condoms and PrEP, and increase your protection levels tenfold, I guess. But I also just want to make sure that it's known that PrEP is in the upwards of the 90s. And also that if you forget to take a pill, whether with PrEP or with PEP, your body is fairly forgiving. So if you miss a pill 1 day, 2 days, maybe you'll be fine.
No more than 3 days.
And Elijah will be here tomorrow talking specifically about yes.
No more than 3
so
days.
we're looking at 70 to 80% efficacy for condoms alone. PrEP alone is above 90%. So yes, for HIV only, because it's not. So we have lower efficacy, but more things that will protect you against. PrEP alone has higher efficacy for the prevention of HIV, but only does one thing. So PrEP doesn't pay your bills, it doesn't, fix a broken heart. It does one thing and one thing well, and it just prevents HIV. That's another good point. So what happens though is providers will be like, well, they don't use condoms, so I'm not giving them PrEP. And I'm like, they're the ones that need it the most. Because if somebody tells me that they're only gonna have condomless sex, that's the way that they like to fuck, I'm gonna say, okay, well, let's make that choice 90% safer. Yes.
I think one thing we don't talk about enough is that we're actually advocates for our health. And so if a doctor or provider tells you, I'm not writing that for you, it is your ability and responsibility to get up from that provider and say, thank you very much, and find you a new provider. I think most times we will follow what the doctor says because we think that they're greater than, but I look at my provider just like a barber, just like a hairstylist, just like somebody who does my feet. If you fuck up once, I'm not gonna give you an opportunity to fuck up again. So this is your body, so respect it as you would treat your hair, treat your feet, treat your nails, and find someone who's gonna take care of you the way you should be taken care of.
Absolutely. So, the thing is that, but some people look up to doctors like they do their religious leaders and other people of authority. And so when they say something to them, they feel kind of crushed or they feel defeated. And then we also think, like most of us are from major cities where we have options. So when we talked about all site testing for gonorrhea and chlamydia, most doctors are not asking about anal health for anybody. Like they just don't care what happens in there. So you're not thinking or asking about your anal health. And most doctors also don't take a sexual history. And so we've created also, this is one of those exceptional things in HIV or LGBTQ confident providers that we actually have these discussions. So this will be quick, because this is HIV testing. I think this is the part that we know a lot about. So for STIs, we talked about the cotton swab. So I'll tell you just, but one of our providers, the doctors that works for Gilead, went to an office and they said, he said, you need to do all site testing before PrEP so that you can catch all STIs. And the provider said, I think that we can only allocate one swab per patient to do all site testing. And our provider said, just make sure they swab their mouth first. And you have to think about that, because if they didn't, if they're only giving patients one swab, and people were swabbing their butt and then swabbing their throat, it would have been a totally different situation. So he said, just make sure they swab their throat first. So if HIV is not in the mouth, so HIV is not in saliva, I'm just going to make that statement. If HIV is not in saliva, how do we test for HIV in the mouth? Antibodies. Right? Antibodies. So you go. So when we do an oral swab, so that's one of the things that comes up a lot. They're like, how do you test for HIV if it's not in the mouth? We're actually taking cells off the mouth that we can get antibodies from, and we're testing those. So it's not in the saliva. So this is stupid. Where do you get tested? Anywhere you want. Don't record that too. How do you get your results? In person, phone, online. You can buy a test, from your local pharmacy. So I've had a guy who called me. He was like, I think I need to get PEP. The guy was there. The condom broke, and he was concerned. So I asked him, I said, is the partner still there? He recently had an HIV negative test, and he said yes. I said, do you think that the partner's willing to get tested? And this was over a weekend. He asked the guy, he said, will you get tested? He said yes. So he went to a pharmacy. He went and bought one of the kits from over the counter. It was like $45. It wasn't how he wanted to spend his $45, but he spent it. So it has like one copay. So he spent the $45, got a test from a pharmacy, swabbed the guy's mouth. The guy actually was HIV positive and didn't know it. So he did get PEP, and the guy got in care. But that was one of those things. So if prevention methods are, if the condom breaks and the person's still there, it's much easier to just ask the person to get tested than it is to go through a full course of medicine. Because if the condom breaks or something like that, or there was no condom and you wake up, then it's much easier just to find out the person's HIV status than it is to start a full course of medicine, when possible. So we're wrapping this up. Some STIs are curable, most are treatable, all are manageable. So knowing your status is much better than not. So understanding that testing and retesting. If you ask somebody, have you gotten tested for HIV or STIs, and they say yes, you go when? And have you had condomless sex since the last time? Retesting is reasonable, is necessary. So I'll tell you what I don't like about this is that this is how to sex and talk with your healthcare provider. Many people in the communities in which we live, we serve, we play, do not have a healthcare provider. They have a sick care provider. And so this is the hard part. This is the part that we have to start a conversation. So maybe, like, if you have 5 people at a table, do you have a primary care doctor? Is that primary care doctor good? Should I go and see your primary care doctor? Can I call them and find out whether or not they take my insurance? Like, having conversations about primary care, about preventive care, about being engaged in healthcare as opposed to sick care. Because if by the time you want PrEP, you're going to just start having a conversation with the provider about the sex that you have, who you have it with in your life, that's a really hard conversation to start up on day 0. But if you have somebody that's following your health, then that person already feels a responsibility and a partnership with you to uplift your health. So healthcare provider, find a healthcare provider, and let's stop being a community of people getting our care at minute clinics and acute care offices. So, rare. So if you want to find somebody that prescribes, any doctor who writes scripts, that could be your podiatrist, your dentist, your optometrist, your primary care doctor, an infectious disease doctor, any provider who can write a prescription can prescribe PrEP. So when you were saying, stop letting doctors run your life, you're like, no. You're here to provide me health care. This is part of my health care. Like, you should be able to write a script for PrEP. And if they don't know how, don't worry, there are websites to teach them how to do it. So, what can we do? Who do we like? We can talk about who we like to have sex with, our partners' practices, reviewing our sexual health, how we like to get tested, when we've been tested, and our prevention methods. So talking to our partners about sexual health, HIV status, you should know if Bay has bays. Like, are we monogamous? Are we monogamish? Like, making sure that we have common language. So when we ask as providers, and those of us who take sexual health, you'll say, so are you in a relationship? You're like, yeah. Are y'all monogamous? Yeah. And you're like, so do y'all share partners? And you're like, yeah. Like, I need to know, like, if monogamous for you means that you only share people together, or, like, you can cheat if you're out of the country. Like, all of those things are things that we should know. Or you're in a monogamous relationship with somebody that's not monogamous. Like, if you're checking phones or, like, social media, then you may not be in a monogamous relationship. So, sexual networks, we talked about starting the conversation. It's time to take action. So this is the last. So we've learned about STIs, we understand risk, we know our prevention options. We have books. So are there any additional questions about HIV, sexually transmitted infections? So we're preventing our preventables. We are valuing our health. We are saying that just because the legacy in America has been that Black and brown people die faster than everybody else does not mean that that's our destiny.